full skin examination is an analysis by your dermatologist or skin specialist to determine whether there are any lesions or spots or areas on your body that might be pre-cancerous, cancerous, or worrying, and an opportunity to talk about things that are happening to your skin and better prepare you for the future and prevent things that might be harmful in the future. My advice would be that everyone at some stage in their life should have a skin check. 50% of our sun damage is done under the age of 20. Therefore, our current recommendation is that from an early age of around about 22, 23, a single skin check should be performed. And from there, you'll be able to better determine whether or not you need to have regular ongoing skin checks depending on your sun damage, or whether they can be less frequent depending on your skin type and the amount of sun damage accumulated. I think all skin types would get value out of a skin examination. The reason being is that sadly our sun is getting stronger and stronger, and even if you do have natural protection in terms of tan or pigmentation, then you still can get skin cancers, and sometimes they're not in the places that you would think of them. There are also other changes in the skin that your dermatologist can pick up, and they'll be able to better prepare you for what life might be able to throw at you and how to prevent some of these changes that are happening. It's also obviously more critically important if there's a family history of having skin cancer, particularly melanoma, and at a younger age. During a skin check, we'll identify any lesion that may be worrying or something that might be concerning for either precancerous or cancerous. In order to make the best call as to what should happen next, we would often recommend a biopsy. Now, biopsy is where you take a very small representative piece of tissue and you analyze it to determine the result. And therefore you can make the best possible call about what should happen next. And that may be cutting the spot out, that may be using a cream or using a device to manage it, or it may be that what you thought was suspicious was actually much better and nothing needs to be done at all. In the process of doing a skin check, before we get to looking at the skin, what we're going to do is have a consultation with the patient where we determine what medications they might be on, what medical problems they may have, and previous history of having skin cancers. This allows us to take a tailored approach about how we would manage anything that we may find in the skin check, and also any advice that we may be able to give as a whole. The actual procedure of a skin check begins with the patient getting undressed. We provide an area for them to get undressed, and a curtained off area in the room, and an area for them to put their clothes aside. Typically, I would get my patients undressed down to the underwear and have them sitting on the edge of the bed to start off the analysis. Every professional has a different approach to their skin check, depending on training, patients, and their comfort. I would generally start at the fingertips and work my way up the arm to the shoulder joint, and then proceed to analyze the face and go into the opposite shoulder and back down to the fingers on that side. If the patient had long hair and it was held out of the way, I get them to let down the hair so we can begin to look at the scalp. Once we've analysed these areas, we get the patient to lie down in a supine position, and we'll look from the head all the way down to the toes, making sure we're looking in between the toes as well and looking in crevices that are visible. We then get the patient to roll over, and then we repeat this process starting at the feet and working the way back up to the back of the head, also looking through the hair at that point in time. Areas that I don't typically look are across the breasts and the genitalia area. Now, I do ask patients whether they've noticed any areas in there, and if they've never looked, I ask them whether they would like me to look, and if not, then I'll ask them to look at home to make sure there's nothing that they're worried about or concerned about. Typically, we will look at the buttock area, but that depends on whether the patient is comfortable or not, and we'll always be asking permission before analysing that area. If we find any lesion, we will mark it. We will get permission to take a representative photograph so we make sure we know where it is. And then if we have concerns, then we may recommend treatment or analysis or further follow-up depending on what we're finding. The first thing I'd say to someone who's going to a skin check for the first time is that you do need to look at the skin. So there is going to be a degree of undressing. And while there might be some trepidation about that, the reality is your skin professional is there to analyze your skin. Not you as a whole, but to make sure that everything is safe. There's nothing to be worried about. And in that context, there's really nothing to be worried about. The reason we get people undressed and view large areas at once is so we can rapidly compare moles to their counterparts to make sure their pattern of mole is the same and there's no concerning features in that one compared to others. When going to your skin check, there's a few do's and don'ts that I would recommend. The first thing is if you are someone who does wear makeup, I'd recommend that you remove off your makeup prior to your consultation, better yet not wearing it to consultation. That allows us to make sure we view as much skin surface as possible and we can be absolutely sure that we're not seeing anything in the area that may be masked by that makeup. The other thing that I would say is that you will be getting undressed to some degree. So wear clothes that are comfortable, that are loose fitting, easily able to be taken off and easily able to be put back on. If you are someone who wears their hair in a stylized fashion, just making sure that you're able to let down the hair so that we can accurately look through the scalp. Prior to your consultation, it would also be good to have a good look in the mirror to make sure that you know roughly what your body looks like and if there are any concerning areas, especially in areas we won't be traditionally looking unless asked for, or whether you had concerns such as the breast area or the genitalia. At the Skin Centre, we allocate 20 minutes to a patient's appointment for a full skin examination. That allows us enough time to analyse the skin, identify any areas, perform any biopsies if required, and also go over any natural questions that would arise from the analysis of your skin and delivery of results or expectations. Your dermatologist would give you an opinion about what they're seeing on the skin. And while we would like to be 100% accurate with everything that we do, in the skin cancer game, the prudent option is to take small biopsies to be 100% certain that you're going to be performing an invasive procedure for the right reason on a patient. So we will often tell the patient that we suspect that this lesion is a particular type of skin cancer and what might happen next. But we would always wait until we had definitive histopathological results before acting on that. Unless, of course, the lesion was very concerning for something very dangerous, such as a Merkel cell carcinoma or a melanoma, and which your doctor may suggest that we do an excision on the day so that we have the highest degree of accuracy for results and also remove it as quickly as possible from the patient. Even though you may never get sunburnt, the reality is that the sun can often be harsher than you think. And while you may not have a skin cancer, there may often be signs of either pre-cancerous lesions or photoaging or photo damage that we can address now earlier and easier than if we wait until the problem becomes more obvious and larger later. So I would always recommend that if you are someone who is in the sun a lot, whether you burn or you don't, that you do get your regular skin checks, or at least a check to determine where your risk might lie so you're best informed about how you can look after yourself in the future. It's never too late to get a skin check. The whole point of having one is so that we can manage what's there. If you have ignored the skin for a while, there will be things to find, but that's okay because we can, generally speaking, manage most things. And to get a plan now is much better than not having a plan at all. To get a plan early is the best overall. And if you are going to do anything, prevention is better than managing anything, right? So the earlier you get the proper advice and the analysis for your skin type, just the better future you're going to have for your skin. Here in Australia, we have lots of options for getting a skin check. I would always advise that someone go see a trained medical professional who can analyze the skin accurately and proficiently. Most patients would have a point of contact with their general practitioners first, and your general practitioner will advise you whether or not you need to see the speciality of a dermatologist in order for more difficult cases, or whether you're better off staying in the general practitioner field for your skin checks. And I would always listen to their judgment, because so long as your skin is being analysed, you're really doing the best thing for it, and in complex situations, you'll always be referred to the right person.